So much of sexual dysfunction, excluding perhaps biological conditions and trauma, can we surrender? Can we be present? Can we allow for our soul to communicate? And can we feel into our partner's experience in a euphoric way that has no words?
Yeah.
Psychedelics teach you that.
Welcome, tribe. I'm Maya Rose.
And I'm Gerald Rogers. We're about to embark on another mind-expanding episode where we dive deep into the realms of psychedelics, sex, and the superconscious.
This is a transformational experience of healing, manifestation, increased clarity, flow, and alignment.
So join us on this sacred journey as we receive the codes of transformation from scientists and psychonauts, shamans, tantra masters, mystics, and more.
Together, we'll unravel the secrets of plant medicine, sex magic, and other tools to tap into higher states of consciousness.
So why are we here? To answer the call, to share our passions and be advocates for alternative healing.
So get ready for a ride that transcends the ordinary and leads you to the extraordinary, because living a legendary life is not just a choice.
It's a sacred adventure. So welcome, this is Gerald Rogers, and welcome to Psychedelics, Sex, and the Superconscious. I am so thrilled for this conversation with Jeff Lundgren, and the topic today is how are psychedelics useful in sex therapy? How do we enhance our sexuality and our experience in life? And it feels especially appropriate for this podcast, where the focus is psychedelic, sex, and the superconscious, that would host him. And I'm really grateful that you came into my life, Jeff. I actually don't remember which podcast I was listening to, and someone mentioned your book, Unfolding Eros, which is a book about a journey into psychedelic-assisted sex therapy. And I'm like, oh, wow, what's that about? And so I went and I bought it right away and I started listening to it. And in the beginning of the story, you start sharing about your journey and how you grew up Mormon and how you live in Utah. I'm like, oh my gosh, like we have so much in common, and he's just right around the corner. And it was like really a beautiful offering that you created with that book. And so once again, Unfolding Eros is a really beautiful book. But for those of you that read this book, you'll understand that Jeff he's really deeply committed to understanding the ethics and understanding the pharmacology and understanding the deeper aspects of how to do sex therapy in a very legitimate and safe and intentional way. And really, it feels to me like, Jeff, you're like a real guardian of this work and making sure it's done correctly, especially in the world of sex therapy, which is such an important part of our healing as a planet, and also such a tender and sensitive part too. So I would love for you, Jeff, I always love starting with a question. I want you to share, is at this point in your career, what are you most proud of about yourself and the journey that you've been on to get here?
Such a unique question. As I think about the journey that has taken me to this point in my career, I feel like I have benefited from my own stumbling blocks. My own story has propelled me in a way to consider the reality of the human condition within my experience. And I think that's become a strength, to recognize that I'm not alone in the human journey. And I think what excites me about the opportunity to incorporate psychedelic medicine into the therapeutic space is the potential, the robust potential to create the kind of durable outcomes that most of my colleagues and I want. And as I think about the connection between my journey and the potential for whatever that looks like as I assist and walk with my clients in theirs, I get really excited about this particular topic. Because in some ways it's become a bit of the culmination of this kind of unspoken dream I've only been able to get words to over the past few years.
I think that's really powerful. And I think, having the commitment that you have to see lasting transformation, I love to see how psychedelics are being integrated into the work that you do as well. You and I have very different but very similar backgrounds in many ways. I mean, not only in terms like growing up in the Mormon religion and having all of that indoctrination and having all of that like experience of shame around sexuality, which I think was like a core aspect of our upbringing. And maybe I'll just speak to myself. But then there was also something in me that had become like deeply driven to try to figure out how to heal myself and heal others.
Mhm.
And so it put me like deep on this path of transformation. And you went down the licensed, tradition. I mean, not traditional, but like the licensed therapeutic route of like really, really diving deep into education and psychology and all the things to help people. And my world kind of took me down the world of transformation and neurolinguistic programming and hypnosis and some of these alternative forms of transformation, but all with the same outcome, right? It's like, how do we accelerate change? How do we help healing happen in a more intentional way? How do we serve people on creating a life that way they want? I would love for you to just share from your perspective, the difference between therapy in a traditional sense versus therapy that uses psychedelics as a tool to enhance the therapeutic experience. And I want to first begin outside of just sex therapy, or although you could address that because that's your focus, is like, what does psychedelics offer to the realm of therapy that doesn't exist in traditional therapy on its own?
I think traditional therapy offers, and we've learned this like as a group of professionals over decades, that any therapeutic model or intervention works because it emphasizes and helps to curate one's ability to differentiate between the problems that they experience and the identity of self that gives them a sense of authentic power, so to speak, rather than relying externally on things outside of them or being dependent on things outside of them. And so classic therapy often addresses how people think, or addressing their feelings, or separating their feelings from the narratives that they create. And there's many different approaches, but whether it's psychodynamic, narrative, cognitive, behavioral systems, and all these different approaches, they really all do the same thing with a different approach. And sometimes the different approach matters. What psychedelics do is they allow for a really high-speed pipeline into the internal working of one's soul, which is ultimately where we want to take people. But rather than building rapport, creating vulnerability, creating a relationship of therapeutic trust, the medicine works within not just the neurochemistry, but the spiritual nuance of one's existence to quickly bring them into that space. And once they're there, they do the work. Now, a coach, guide, therapist, whomever can help facilitate, hold the space, guide them, help resolve things as complicated or not that might be. Ultimately, the work is done within oneself such that the demand that normally we experience in classic psychotherapy that could take weeks or months or years, we can condense down into a very small space of time. It comes with its complications, of course, but I think it's, simply put, just a faster way to move people into a space of healing, and one that creates better outcomes with less dependency on things like medicine or an ongoing therapist and or living in situations that aren't quite as ideal. It pulls people out from the inside in a way that works.
Yeah, thank you for sharing that. And I think one thing that I've noticed, in different stories and different people I've experienced, is that I've known people that have spent, sometimes years like trying to touch or resolve certain trauma or certain issues, and they've been unable to create more than just awareness and like knowing how to like manage it. But then in some very powerful psychedelic experiences, all of a sudden in like one ceremony, one experience, all of a sudden that thing gets resolved or realigned or shifted. And sometimes literally like years of therapy happen in a very, very condensed time, which I think is like really inspiring. And, from my perspective, I think one of the things happens is a lot of times when we're using some more traditional forms of transformation, it's like really, conversations at the conscious level, creating awarenesses, having, conversations, having, like this very conscious level experience of recognizing and seeing what's happening in life and like, being able to discuss it, which is sometimes really helpful. But so much of the change that needs to happen is at a subconscious or super conscious level, which is sometimes really hard to touch when people are in that, that beta wavelength. And so when there's a really meaningful psychedelic experience, sometimes it can bypass and get people out straight to that theta or really access these deeper states of neuroplasticity, which allow change to happen. And I think one thing is important about this is being able to distinguish like that person that's doing the work is still doing the work, and it's not the MDMA, it's not the psilocybin, it's not the ayahuasca or whatever doing the work for them, and to remind people it's like, no, you are the medicine. This is just a tool to help you remember the frequency of wholeness. And I think that's really important. I want to talk about your specialty though, which is around sex therapy and really helping people resolve this. And I'll frame this by saying, for me and my goddess, my rose, psychedelics are a really integrated and really important tool that we have in a relationship to enhance, magnify, accelerate our relationship, to make us fall even more in love with each other every time we do journeys. But we also have a very like healthy sexual dynamic. So we're not like trying to resolve like deep levels of trauma. And so I'm really curious for you. I want to begin by rewinding back a little bit and having you share, why did you get into this specific niche and why was that important to you? And then I want to have you share some of the case studies of like what you've witnessed in helping people really heal, like one of the most sensitive and vulnerable and important areas of their life, which is sexuality.
Yeah. When I first started, well, before that, I think I was in, probably halfway through grad school, early grad school. I was invited to an ayahuasca ceremony and I didn't know anything about it. I really didn't. I was super naive in any, psychedelic anything or frankly, any illicit, mind altering substance. I didn't know, I had no experience with anything. And some of that was just because of my religious upbringing, being raised Mormon and strictly adhering to the principles taught in the Mormon church. I found it somewhat frightening, if I can use an appropriate term, but also intriguing because of where I was at in my life. And I found that experience very, very transformative for me, just within my identity, how I saw myself, how I saw other people. And that's it's ineffable, very hard to describe, frankly. And as I began working as a therapist a few years later, and having kind of a desire to work with adults and couples and do a lot of relationship work, I found that sexuality came up frequently. I think practicing in Utah provides a professional benefit, so to speak, in that it's never boring, and content around sexual dysfunction is frequently connected with one's religious upbringing because, if they're raised Mormon, as many high demand religions do, there tends to be a lot of shame and philosophies rooted around very conservative sexual expression, which might work for some people, but for a lot of people, many of my clients, they show up in my office and they talk about erectile dysfunction or pain or embarrassment or lack of pleasure or desire or guilt, whether it's, their own fantasies or their own experience with erotic material or whatever that happens to look like. And subsequently, the stories were so consistent and so frequent that I felt somewhat incapable of addressing them. So because I was familiar with some colleagues I work with in their training, I I pursued it's about a 2-year program as a certified sex therapist, ASECT, and the training is robust and very very comprehensive. And it was about this time that I started to notice a lot of ketamine clinics popping up everywhere. If Utah is anything, it is definitely innovative. And like some places in the country, as psychiatry began to understand the impact of ketamine for psychiatric conditions, many in Utah decided that they would venture out and open up a clinic. So I got curious about ketamine, and curious again for my own experience with ayahuasca some years before, what would be the impact of these medicines specifically addressing sexual dysfunction. I knew that there had been, to that point, and some of it from decades past, in some of these medicines and their ability to help with things like depression, anxiety, suicidality, trauma, and many, many more. The literature was rather sparse. There wasn't a whole lot about sexuality for whatever reason. And the two topics just kind of sparked this interest in this intersection between human sexuality and psychedelic medicine. And that's when I got another certificate. It was a whole year-long program of the use of psychedelic medicine, ketamine, MDMA, psilocybin, and others. And then began to incorporate that as I felt competent with that certification to use some of these medicines in my practice. And then I was able to see and experience the transformation firsthand. And that's magical.
Yeah, that's really amazing. Like, share with me like some of the symptoms that you frequently see people coming to you with that are like the ones that you notice the greatest impact with. Like, what are some of the symptoms that are commonly expressed?
Yeah. So some of them are unique to one's cisgender, erectile dysfunction for men, different forms of conditions for women, such as, vaginismus, dyspareunia, pain, in different ways, along with, for men, premature ejaculation, also arousal differentials, libido differentials, interest in sexuality, other kinds of discrepancies, and even hypoactive sexual desire, which is kind of an interesting thing, or complete aversions, right? It just depends. But there's a lot of underpinnings, trauma-related, psychosomatic, cognitive distortions associated with sexuality, social stigmas, shame, relationship dysfunction that really is causal in perhaps a couple's intimate experiences. So it gets quite complicated, but I've seen all of these things.
Well, that's so fascinating because at the surface level, you see all these like things showing up, and I imagine that the root cause for each person, even if it's a similar symptom, can be vastly different. Like, what's your process for guiding people to the awareness of what's actually the core root, whether it be, physical, chemical hormonal imbalance, or some trauma, or some like hidden psychological, disconnect? Like, what's the process to figure out what is the root cause?
Right. And it's an important step, because sometimes it's more than one thing. And sometimes the order in which somebody has a particular experience can compound and or eclipse some other factor that one might want to consider. So it's an assessment process. It's a conversation. And even when we're using a psychedelic medicine as a part of the treatment plan, that can be a session or 2 or 3 talking about, when did you first learn about sex? With what you're experiencing now, when did that first show up for you? How do you feel about that? How does your partner or partners, how did they feel about that? Have you seen your doctor? What does your doctor say? Should you even see your doctor? Their beliefs, their cultural expectations, what works, what doesn't work. What do they even want? And why do they want it? Or why do they don't want it? Whatever's showing up. And so those conversations are helpful. And once I with my client have a picture as to what's taking place, then we talk about that. And I say, I think that your situation is impacted by this, this, and this. And then we have the beginnings of an intention. So if we do a traditional form of therapy, whether we're using internal family systems or cognitive behavioral therapy or whatever the approach is, we connect it back to their intentions. With a psychedelic medicine, that's like really, really important. So we name that specifically and we talk about what they're hoping for. And then as we enter the next phase with the medicine session, we're connecting the results of the assessment in with their intentions. And then we follow that as a part of the whole arc of treatment.
And do you have a favorite medicine that you personally like to use for these different things, or is it based on a person by person basis?
Yeah, such a good question. And what makes the answer complicated is the legality of some of these medicines.
Mhm.
And in some situations, the appropriate use of that medicine, even if we can work around legal constraints. So in most places in the United States, and including Utah, ketamine is a legal medicine used off-label. I find it helpful because it's such a strong dissociative. If we need to create a distance between somebody's situation and their identity, it's a fantastic medicine. It's also very short acting. So we can do a lot of work in short bursts rather than committing hours on end. It's relatively affordable because it's a short duration of time. But there's things that ketamine's not really that effective for when we're talking about human sexuality, where something like psilocybin or MDMA are more popular to address specific issues, whether it's trauma, which I would lean to something like MDMA, or whether we're talking about social reconstruction, shame, guilt, rebuilding an identity of self, or if there's some comorbidity, whether it's substance abuse, body dysmorphia, or other kinds of things, which can impact sexuality for sure. The psilocybin's a fantastic med, especially with mood disorders. But again, these last two, MDMA and psilocybin, are both illegal. They're not allowed for therapeutic use yet in the state of Utah. So I have to work with and in adjacent jurisdictions that allow for the use of those things with other colleagues or ways I can collaborate.
Yeah. Yeah, that's such a fascinating thing. This is more of a curiosity because I think we all have our perceptions of like the story behind the story, But
Sure.
I'm always curious to hear people's perceptions of why, just at a core, like systemic level, why these substances, why we think these substances ever got put on this Schedule C classified as these like dangerous to humanity things. Like it's so ironic and hilarious, especially with something like mushrooms, which grows from the earth. And it's like been this natural indigenous medicine for like how that somehow became legal when it's actually one of the most beneficial and supportive things. So I'm always curious, like whatever your story is, like, why do you think was made illegal and why do you think it's still illegal when it's so clear how powerful and beneficial it is?
I would answer that a couple of different ways. If I'm cynical about the history of how psychedelic medicines were banned, essentially, I kind of grab a hold of some of the cultural positioning at the time, and I think it was largely just a way to control people, truly, and or promote racism because it was easier to incarcerate people of color from their use of medicines because then they had an illegal feature to include as a part of how people were being controlled and managed at the time. I think also there's some threat. I think these medicines in general, used responsibly, alter people's consciousness in a way that makes people who occupy positions of power threatened, because people almost ubiquitously approach the world they live in differently with more compassion. So much of what I think plagues us as a culture is our hyper need to be and celebrate individuality what's mine, my freedom, my right. And I think part of the spiritual aspect of the use of a psychedelics experience is I belong. I'm a part of all that is. And fundamentally, that shifts, I think, people's political ideals. I think it changes their priorities a bit in ways that I think are helpful. I think that's threatening for other people. So sadly, we look back to the war on drugs as a very tragic event in the progression in how we could have solved and or prevented a lot of pain and suffering for people. And I'm glad we're at where we are, but it is kind of a grief to think about how we as a country responded pessimistically when we could have chosen something different.
Yeah, I agree. Like I don't normally speak into the soapbox, but it feels to me as I study the history of psychedelics and the culture, especially back in the 60s when this was first emerging, that like it came when there was like this massive pressure for the Vietnam War, and there was all these like, things and like the people that were taking psychedelics, these quote unquote hippies, they were not buying it. They were not buying the separation and being sent to war. And I can imagine for Nixon and, the early stages of the war on drugs, like it was like, how do we actually get these kids back in line, But then to like see like, it really does feel like a tragedy, like knowing how effective it's been proven that MDMA is for like PTSD or these other things, and think of just like even like thinking of how many veterans have lost their lives to suicide because of PTSD that could have been prevented if the research hadn't been stopped back in the 70s, and if there would have been more things. And what a beautiful thing that I think it feels like that with this renaissance that's happening, there's so much energy. Like literally everyone I know is like diving into psychedelics and have a really positive perspective of it, and even it's interesting because I even keep hearing from people within the Mormon church that, their bishop just went down and did ayahuasca, or they're people from their, these different things. So even within infusing in different, religious ass corners, there's people that are being exposed to like the healing power of MDMA and all these other things, and just gives me a lot of hope. And it was really fascinating last year when the FDA shut down this big initiative for MDMA to be legalized, and whether it's good or bad, I don't know, but it's like it feels like as a culture we're ready for a different way of doing things, and I'm excited. And I don't know if you have any perspective of like where the future's leading with this, and what you hope to see specifically around sex therapy in psychedelic terms. Like, what would you like to see the future look like?
I'm optimistic, which is my personality. I'm hopeful that, and I follow some of these things, but I'm hopeful that legislators and professional boards and other influencing organizations continue to promote the healthy use of psychedelics. It's delicate because some of these medicines have been used for thousands of years. And I think it's concerning that it's so easy to appropriate the use of those medicines, not only within the Western medical model, but recreationally with people who have no training or understanding of how powerful the medicines are.
Yeah.
And so ideally, I think it would be very beneficial to have regulators and lawmakers sit down and say, okay, and they have, and they're continuing to have the conversation. We need to include these medicines for these reasons. We need to make sure that professionals are expected to have certain training so that they are used ethically within the scope of their practice. That's the whole purpose of licensed providers.
Mm-hmm.
And then be able to facilitate, or not facilitate, but to be able to share the knowledge and broaden the bandwidth with those people that get training from other perspectives, whether it's shamanic or whether it's secular, whether it's religious, as some experiences are, so that we all agree that they're powerful, they're transformative, we have to be ethically minded. And perhaps I come at this with a little more caution than maybe others if we're just dealing with, anxiety and depression. We're dealing with human sexuality. Like there's a lot of trauma with people's experience with sexuality. I think there needs to be an ethical approach generally with how we intend to use these medicines there. But I think the capacity to do so is within our grasp. And all we have to do is both advocate and be patient.
Yeah. Yeah. And I love that so many people are bringing their energy to it. I was just talking to a dear soul sister of ours that lives down in Arizona, and she's meeting with a legislator again, and she feels like they're just getting near passing, support for a psilocybin bill that will allow that work to happen. And I think it's clear that it's going to happen at a state level first, with these
Undoubtedly.
states leading the way, and the research just continues to come in. That's just mind blowing. It's just like so unequivocally clear, the benefits of it. And also like being aware that there are people it's not right for, and it's like really important to be able to distinguish that. Like what would you say would be the reasons why someone should not, pursue psychedelics as a way to support their, sex therapy or their sexual healing?
So there are psychological, there are pharmacological, social, and other reasons that someone would want to be more cautious. There are some mental health conditions that one should probably be careful with. It's kind of sad actually. One of the myths that came out of the 70s is that psychedelics would cause psychosis, which is not true whatsoever. But if somebody has a propensity towards something, let's say schizophrenia, and they're presenting with psychotic features that might be important to avoid the use of psychedelics, which could accelerate a prognosis for them. But this is really rare. Bipolar 1 in a manic phase, psychedelics amplify. So let's not amplify what is already too amplified. There's some drugs that are commonly used for mood disorders and other conditions that are either counterproductive, they might increase risk or blunt the effects of a psychedelic medicine. Classic example is the use of SSRIs, drugs that, help to reduce anxiety or depression, but they are already connected to the receptors that many of these psychedelic medicines wants to use. And so people find out this isn't doing anything. I don't feel anything. So they take 2 or 3 times as much, which isn't pharmacologically risky with something like psilocybin, which the toxicity rate is ginormously high. But with a medication like MDMA, there could be other complications that people introduce because they're unaware of blunting effect. Ketamine is the same thing true with ketamine and other medications. Sometimes people need preparation time. These are potent medicines, and there needs to be an appropriate container for the use of them, the environment, what we call the set and setting, our intentions, and then how do we protect the space where they're experiencing the psychedelic medicine. It's important. It's really, really important. History of trauma. I've had clients that have had trauma, and we don't know always where the psychedelic medicine is going to take them. So how does the trip sitter, coach, or therapist know the difference between the emergence of this new beautiful consciousness between an emergency that's related to an unknown or known former trauma? So it can be complicated, but at the same time, these medicines are actually remarkably safe. When we compare them to the mainstream of medical interventions pharmacologically, we find that the footprint of risk is very, very low with psychedelic medicines. It does have a psychological, the capacity psychologically to create something problematic. We refer to these as bad trips, but bad trips are containable. And the entire management and risk profile is actually quite low. So That's how I would answer that one.
Thank you. Would you share, just for anyone that's listening that might either be experiencing, some of the symptoms of, sexual dysfunction or whatever that you talked about, or they might know someone, can you just share a couple stories? Because I think we've learned so much from stories and just hearing about, and somehow it gives us hope and direction, and just like share some stories with us that inspire you about this.
Yeah. I'll share a couple of stories. One in my book I write about, which is just memorable, but I worked with a young man. He was a musician, and he had gone through some separations from a former relationship that really just derailed him. And he found that he had no enjoyment with sex. It was just bland.
Yeah.
It's easy to recognize, or at least theorize, that much of why he experienced was just from the traumatic ending of a relationship. And there was a lot of truth there, but underpinning that for him was just the inability to distinguish the fact that he was so artistic and creative and beautiful as a human that he couldn't reconcile the fact that his ability to experience positive sexuality was so limited, and he couldn't understand why this difference was happening for him. And he had sought out LSD through a friend, and so, which is a very long-lasting medicine and therapeutically is very, very interesting, but also is really burdensome. But he had already sought that experience, and his friend had some experience, and so he did an LSD trip. And he came to me nearly immediately after, and we did some integration work to reconnect some of his heart to head tethers, and it was really quite remarkable. His ability in the medicine experience to see the beauty in and around him rewired something for him. And it was really interesting as I got to hear his story and participate in his thinking and his emotional expression. It became clear to me that his transformation to experience sex in a very meaningful and beautiful way, again, had much more to do about the congruent way in which he wanted to be authentic in the bedroom, so to speak, and also in his profession and in every other way in his life. And the medicine was able to lower the barriers that he had erected that prevented him from being authentic in that way long enough that he could say, that's artificial. This is who I am. This is what I want. And it became not just a concept, but it became a reality for him. And it was magical to hear how in the moment he was able to, play his piano and do these other things and do some artistic things in a way that really deeply reignited and made it possible for him to experience sexual pleasure in the way that he wanted. It was a fascinating story.
What I've noticed is, especially psilocybin and MDMA, and sometimes when they're stacked together, it just activates so much pleasure within our body, which is sometimes such a powerful way to heal, just to feel how good it is to be human, feel how good touches, to feel how much love there is that exists within us. And sometimes there's a lot of people that approach, trauma therapy by going into the trauma and like digging through the darkness. And I think there's a time and place for that, but sometimes it's just actually remembering how pleasurable life can be and actually diving into the pleasures can sometimes be the most healing thing. And to reactivate that on someone is like really sacred.
I worked out of state with a couple, my clients here. They had been married for 15, I think maybe 20 years perhaps. And there was some significant relationship injury due to infidelity on both of their parts. There was so much fear and so much regret and guilt associated with the experience. They could not get past the guardedness and the preservation that they were experiencing. Their sympathetic nervous systems were always activated. They were always ready to argue and defend and blame. And so much of it was internalized. And we could have gotten through it. And I said to them one time, I said, we could do this the slow way, or we could do it the fast way. case want to go to org. And it's interesting, right? MDMA has this amazing quality. It's known on the street as ecstasy. It's a rave med, and it's labeled and used in that way because it does what it does well. It's a very pro-social and makes people feel connected and warm and having fun and bubbly and very somatically engaging. It does this. Therapeutically, it turns off the sympathetic nervous system. It turns off fight, flight, freeze. Not entirely, but pretty well. And this couple in their medicine session, they could hold hands and look at each other and cry. They could touch each other and say, I understand you. They could say, I forgive myself. I can forgive you. And they could do it with a conversation that I could never cultivate. I could never create that dialogue for them. It would never be appropriate for me to do that anyway, but I could participate in holding that space with them and subtly, very subtly guide them. They're doing the work. The way all psychedelics work, that neuroplastic genesis that occurs in appropriate settings, although it actually works in all settings that are inappropriate, which is why we have to be cautious. But for them, they were able to viscerally remember as a part of their identity that was not arguable for either, that they knew who they were and what their relationship was about and their ability to connect with each other.
Yeah.
That's transformative. And we had a couple of cleanup sessions, but they were fine after that.
Yeah, I've seen that same thing, especially in MDMA. It's just like it lowers the barriers, the walls, and lets people open up. And one of the things that we do in the work that we have with our couples sometimes is a practice of unknowing, which is, when we're in a relationship, especially when there's wounds and disappointments and all these like triggers and stuff, we start building this perception of who the other person is and build this story of who we think they are and why we can't love them, or why we can't trust them. And the practice is unknowing. It's just like releasing all of that and experiencing the truth of who's in front of you in that moment and opening up our heart and receiving that. There was a couple that we worked with that they'd just been married for like 2 months, but man, they were just like, couldn't figure out how to get their lives to fit together. And it was like, they were experiencing all these triggers and upsets and disappointments and all these different things. And, we guided them, through this process of just opening up their hearts and witnessing each other for the first time. And it's almost like,
Beautiful.
Even if people have been married for 10, 15, 20 years, it's like they fall in love again for the first time. And it's deeper because it's not their ego interacting with each other for the first time. It's their soul being open to receive the soul of the other person. And then, of course, we set the space, and then they went off and they had the best lovemaking of their entire life. Which is like a really beautiful thing about the medicine, is it just opens up our heart, connects us with pleasure, and allows us to exchange energy in a way that's not filtered by the way that sometimes our brain interrupts. So
much of sexual dysfunction, excluding perhaps biological conditions and trauma, can we surrender? Can we be present? Can we allow for our soul to communicate? And can we feel into our partner's experience in a euphoric way that has no words?
Yeah.
Psychedelics teach you that.
Yeah. And then can we forgive? Can we create a new vision? Can we pour energy into what matters most? Can we like reignite, inspire love? It does like such a gift, to go beyond just a conscious mind of like, okay, we know what we should do, to all of a sudden having like an experiential moment where we're like embodied. And I think that's what I really appreciate about the medicine, is the embodiment, the somatic aspect of actually not just talking, hey, I love you, you're so great, but actually feeling that at a deep heart level. And it changes relationships, and it heals wounds that have existed for a very long time. I'm curious how in your personal relationship, you're married, right?
Correct.
How have you found psychedelics useful in your own relationship experience? Is that something you integrate with your wife and have experiences to deepen your sexual connection?
Yeah, so I'm newly married, which makes that story shorter. But in our relationship, we have had a moment where we had used some medicine as a way to explore something differently. With a larger umbrella, I would answer it this way too. And it's interesting how people describe this, and so I'm going to describe it in the same way, but I think we can personify the medicine. We give it an identity. The medicine taught me, which is a very interesting thing to consider. But the reality is the medicine in conjunction with us, it's ourselves, but the medicine teaches us something about ourselves. For me, those lessons have transformed how I see myself. I think one of the biggest things that I've experienced over many years is kind of realigning with who I find I am versus who I was told I should be. And this is where it dovetails with my Mormon experience. There's a lot of prescription around what it means to be masculine and male and valuable and worthy. And I don't think that the interpretation that we have, I didn't in every way, allowed for me to experience intimacy with my partner in a way that promoted their well-being, because I was adhering to something that wasn't mine. It wasn't who I am. Mm. And so much of how we show up in intimate spaces prohibit our ability to express that or express any amount of experience. And I think when we amplify our authentic being in a way that becomes more clear and more real, I think at least it has for me, it's made those experiences beautiful and more meaningful.
I really love that. I love that you talked about how we learn from these medicines. I think words are actually really significant, and even how we label these things. And I was thinking about the meaning of these different words that we have. That some people call it drugs, like a drug, drugs are like, even the word drug is fascinating because it ranges everywhere from an aspirin to a pharmaceutical to heroin, and crack. Mm-hmm. Like, it's such a broad, vague, and often distorted word, especially when people are associating MDMA with like cocaine or something. And it's like almost funny that word would be associated to. There's people that like numb it down and just say substance, which is so generic and doesn't actually have any, like, it's like, how do we take all meaning out of it? The word medicine is fascinating too, because once again, it has like such a play in like things, and like it's a very commonly used term for it, but also a little bit sterile and a little bit, I don't know if it fully honors. One of my friends just calls them master teachers. And I actually really love that, like I'm sitting with a master teacher, whether it's ayahuasca or whether it's MDMA or whether it's LSD, whatever it is, it's like actually experiencing it as a, energy and a frequency that allows us to tap into a higher state of consciousness. And I've really liked that. I like that frame of being willing to be a student. And I think so much of, I guess, this journey of transformation that we're on personally, the journey of transformation that we're guiding and supporting other people on as they're looking to change these things that aren't working in their life. The journey of transformation requires a level of willingness to look at life different, which is all this really is, these master teachers, these sacred substances, these plant medicines, whatever one might call them, they help us to see differently. They help us to see ourselves differently. They helped us to see our trauma, to see our past differently, our relationship to the world differently. They help us to see each other differently. And I think that's the gift that maybe as humans we need more than anything, is just to create a new frame for how we experience each other and how we experience the world. And I think that's where the healing exists. So with that, I would love, Jeff, for you to share any final thoughts that you have for the people that are listening right now, anything that your soul's like, oh my gosh, I just want to make sure people remember this. And then I would love for you to share how they can experience more of you, and especially anyone that, is dealing with sexual trauma or is dealing with things that they need some really significant support with, how they can find you. Because like what you do in psychedelic assisted sex therapy is really unique. There are not many people I've ever encountered that I know of that specialize in the way that you do. And I think it's so relevant and so important. So yeah, what's your message and what's the next step for people?
One of my favorite quotes by a sex educator probably is the best title I can use. Annie Sprinkle said, "It became clear that psychedelics had been perhaps my greatest sex education." I think is how she said it. That's interesting. There are some very similar spiritual, pseudo-spiritual, physiological moments where there's a very strong familiarity between how people experience psychedelics and how they experience sexual arousal, climax, the energy of it, all of it, however we label and define it. I think there's a human need to express and experience that, which is why human sexuality is such an important theme for people to experience in a positive way, for the people that want that. And so I haven't met a lot of people that haven't been super interested in, well, how do I enhance or how do I repair? Is there something that psychedelic medicine that I've been hearing about where it's maybe about suicidality? Perhaps it could be about enhancing sexual pleasure or any of these things. And my short answer is yes, like there's a lot there. How we do it, I think, requires a little bit of exploration or perhaps counsel from someone who might know more about that. The big takeaway would be this. The whole reason why psychedelics work is that they allow for the brain to rewire itself. And with an appropriate intention held in a sacred space of this, a container where that intention can be found and harvested and then subsequently integrated. All of this is important. All of this is the whole point of using psychedelic medicines. And although there are some exceptions where people can enhance a sexual experience concurrently with a psychedelic medicine, almost always in a smaller dose, I think the bigger opportunity is moving into a space, into an altered state of consciousness where one's default observation of the world and their sexual experiences is completely revamped and changed. That's where it happens. That's where the power is. And so my invitation would be to those who are interested is learn more about that. My book's not the only book out there about psychedelics for sure. I think it's not entirely unique, but pretty unique in this intersection. But there's a lot we can learn. And I think there's a lot that we can do as we, funnel and channel our intentions into something meaningful, because we're all very different and what we need and what we have, resource-wise to accomplish that. If anybody wants to contact me, the best way to reach me is probably through my website or my socials. If you go to Jeff Lundgren, LUNDGREN.com, then I've got resources there on things I'd like to pontificate about from time to time. But I've got links to social media. Of course, my clinical footprint, people can find me here in Utah at Oak Branch Counseling, and you can just Google that. It's easy to find.
Mm-hmm. Thank you so much. And thank you for
You're
your contribution to this field. Thank you for your dedication to bringing more awareness and bringing more healing to this area.
Thanks,
which
Gerald.
is so important. Oh my gosh. The ripple effect that happens in people's lives, people's families, people's homes.
Significant.
When they heal, and then when they activate like the remembrance of who they really are is really important. So thank you for that. It's an honor to get to know you better. Thank you for this delightful conversation. And for everyone that's listening, thank you for joining us. We love you. Thank you for being part of our soul family. And we look forward to having you join us for future soul conversations like this. Until then, just remember, this is your life. Make it legendary.
Thank you, legendary explorers, for joining us on this cosmic journey today.
Your curiosity fuels our exploration of psychedelics, sex, and the superconscious.
If you're hungry for more, dive into our website and connect with us on social media. All the links are in the show notes.
And stay tuned for our next mind-expanding episode. We can't wait to talk to you again in our next adventure.
Until then, remember, this is your life. So,
make it legendary.